Morning Coffee Talk with Amy. This is what I look like on a Sunday morning. I apologize. Today's topic is Meniere's disease and maneuvers, such as the Epley Maneuver. If you don't know me by now, my name's Amy Moore. I'm a vestibular physical therapist, which means I treat dizziness and dizziness-related conditions, and I do treat a lot of BPPV, less so with Meniere's disease because therapy is not as effective with Meniere's disease. However, my own mother has Meniere's disease of her right ear. Hi, Mom. And I am very well researched on the topic. So I've gotten at least 3 questions in the last couple of weeks about whether Meniere's disease is treatable with the Epley maneuver or other maneuvers such as the Foster maneuver. The short answer is no, absolutely not. Maneuvers treat BPPV only, which means ear crystals. To the layperson, your crystals are out, which is a totally different disorder and a different mechanism than Meniere's disease. If that's all you wanted to hear, the quick answer, then you can go. But if you want to hear my explanation as to why, feel free to stick around. So with BPPV, which stands for benign paroxysmal positional vertigo, or some people just know it as ear crystals, you have a sudden and severe spinning sensation that is caused by calcium carbonate crystals that reside inside your inner ear canals. They break off from their resting place and they go tumbling into the canal. And every time you move your head or change positions, it displaces a lot of fluid in those semicircular canals. And those semicircular canals have the job of detecting acceleration of fluid. So if the crystals are accelerating the fluid a lot, they're sending a signal to your brain that you're spinning really, really fast. And that's why you feel spinning really, really fast. The treatment for this is maneuvers such as the Epley maneuver. Now I'm going to patch into this video me performing an Epley maneuver with an ear headband on that has mock crystals in them to show you how an Epley maneuver and other types of maneuvers can get the crystals to flow around the tubes and back into the main sac where they belong, which resolves that type of dizziness. Maneuvers tend to be very effective at resolving BPPV, but you have to make sure that the cause of your dizziness is BPPV and that you're targeting the correct ear and the correct canal with whatever maneuver you selected in order to get all the crystals around the tube and back into the main sac. Now, how does that differ from Meniere's disease? Glad you asked. If you look at the inner ear anatomy, that light blue area, that's actually embedded inside your temporal bone. And those are a series of labyrinthine tubes that are open spaces inside your skull in order for that fluid to reside inside of there. And there's supposed to be fluid inside of there. It's closed off from the outside, so this is a closed system and it gets fluid from your lymphatic system. Now, the inner ear is not just empty spaces inside your skull. There's actually a pouchy-like structure on the inside that encases all this fluid up inside the semicircular canals, the utricle, the saccule, and the cochlea. With Meniere's disease, I'm going to make this smaller so you guys can compare side by sides here. There is an increase in the amount of fluid that has been taken in by the lymphatic system inside this closed system. We're honestly not sure why some people develop Meniere's disease, but usually it's after some sort of infection, sinus infection, ear infection, and it probably has to do with damaging of the valves that allow fluid in and or out of this system, because there's constantly new fluid being introduced and old fluid being let off. So with Meniere's disease, we see severe fluctuations in the amount of fluid that is inside the inner ear at any given time, which increases the pressure when there's too much fluid in there. When that pressure increases, it stops the ability of the fluid to be able to flow like it used to. It also puts pressure on the little nerves that are inside the ear that feel the fluid flowing at any given time. So it causes the ear to feel full, the ear that is affected to feel full, and it also causes your brain to start detecting movement a little bit off. It is a common symptom of Meniere's disease to also feel spinning, so a lot of people might confuse that spinning feeling with BPPV. The only way to truly know if you have BPPV versus Meniere's disease as the cause of your vertigo symptoms is to go to the doctor, because they can perform a series of tests to be able to tell you if you have one disease versus another. However, I will tell you that BPPV is episodic, usually comes on once in your life or maybe once a year for people who have it recurring, and it usually only lasts 2 to 3 weeks, and then it kind of goes away for years. Whereas Meniere's comes with hearing loss, ringing in the ear, fullness in that ear that is brings on episodic vertigo and dizziness symptoms and imbalance symptoms that are more chronic. So back to my original question, will an Epley maneuver or any other type of maneuver resolve Meniere's disease? Absolutely not. Putting your head in those positions will not cause any debris to flow if you have Meniere's disease, because there is no debris in the ear. So if anything, it'll just flare you up from being in those aggressive positions. Thanks for sticking with me this long for Sunday Coffee Talk with Amy. They always do tend to run long because I choose a topic where we can talk for a while. If you're still here, let me know by commenting your favorite summer activity via emoji in the comments.